Epilepsy is a brain disorder that affects millions of people worldwide. It causes seizures, which are sudden bursts of electrical activity in the brain. These seizures can vary greatly in their intensity and impact on the individual. Seizures are sudden bursts of electrical activity in the brain. This abnormal electrical activity can disrupt the normal functioning of the brain, leading to a variety of symptoms. These symptoms can range from mild to severe, depending on the type and duration of the seizure. These bursts can cause different changes in the body, such as convulsions, loss of consciousness, or unusual sensations. The experience of a seizure can be frightening, both for the person having it and for those around them. Knowing what to do during a seizure can help keep someone safe. It's crucial to stay calm and ensure the person is in a safe environment. Move any dangerous objects away and gently guide them to the ground if they are standing. It's important to remember that not all seizures look the same. Some people might experience convulsions, while others might have subtle symptoms like staring spells or brief lapses in awareness. Some people might have stiffening and jerking movements, known as tonic-clonic seizures. These are often the most recognizable type of seizure and can be quite dramatic. Others might just stare blankly for a few seconds, which is characteristic of absent seizures. These can be easily missed or mistaken for daydreaming. Many things can trigger seizures in people with epilepsy. Common triggers include stress, lack of sleep, and flashing lights. It's important for individuals with epilepsy to identify and manage their triggers to reduce the frequency of seizures. These triggers are different for everyone. What might trigger a seizure in one person may not affect another. Keeping a seizure diary can help individuals and their healthcare providers identify patterns and triggers. Some common triggers include stress, lack of sleep, and flashing lights. Managing stress through relaxation techniques, ensuring adequate sleep, and avoiding known triggers can help in controlling seizures. Even though seizures can be scary, most of them are not emergencies. Many seizures stop on their own within a few minutes. However, it's important to stay with the person until they are fully recovered and to offer reassurance. However, it's important to know how to help someone who is having one. Basic first aid for seizures includes protecting the person from injury, timing the seizure, and knowing when to call for emergency help. With the right knowledge and preparation, you can make a significant difference in the safety and well-being of someone experiencing a seizure. Recognizing a seizure is the first step to helping. There are many different types of seizures, so the signs can vary. Sometimes it can be hard to tell if someone is having a seizure. Some people may experience an aura before a seizure. An aura is a warning sign. It can be a strange smell, a feeling of fear, or seeing flashing lights. During a seizure, a person might fall to the ground, have jerking movements, stare blankly, make unusual noises, or lose control of their bladder or bowels. If you see someone with these signs, it is important to stay calm and take action to keep them safe. If you see someone having a seizure, the most important thing is to stay calm. Your calmness can significantly impact the situation, providing reassurance and stability to the person experiencing the seizure and those around you. Your calmness can help them too. It's crucial to remember that most seizures are not medical emergencies and will end on their own within a few minutes. Here's what you should do. First, time it. Note the time the seizure starts. This helps doctors later. If the seizure lasts more than 5 minutes, it's time to call emergency services. Timing the seizure is crucial. It provides valuable information to healthcare professionals and helps determine if further medical intervention is needed. Next, safety first. Gently guide them to the floor if they are standing. This prevents falls and reduces the risk of injury. Clear the area around them to prevent injuries. Remove any sharp or hard objects that could cause harm. Creating a safe space is essential. Cushion their head. Place something soft under their head, like a pillow or a jacket, to protect them from injury. This helps prevent head trauma. Turn them on their side. If they are not already, gently roll them onto their side. This helps keep their airway open and allows any fluids to drain out of their mouth, preventing choking. Finally, loosen tight clothing. If they are wearing anything tight around their neck, gently loosen it. This ensures they can breathe more easily and reduces the risk of further complications. Stay with them until the seizure ends. Offer reassurance and comfort. Once the seizure is over, they may be confused or disoriented. Help them to a safe place and stay with them until they are fully aware. Section 4. Seizure safety, what not to do. There are also some things you should not do during a seizure. Don't restrain them. Holding them down can cause injuries. Let the seizure run its course. Don't put anything in their mouth. Contrary to popular belief, people don't swallow their tongues during a seizure. Putting something in their mouth can block their airway or injure their teeth and gums. Don't give them anything to eat or drink. Wait until they are fully alert and able to swallow safely before offering food or drinks. Don't try to wake them up. Shaking or shouting at them won't help and might confuse them when they are regaining consciousness. Section 5. When to seek medical help, emergency situations. Knowing when to seek medical help during an emergency can be the difference between life and death. It's crucial to be aware of the signs that indicate a situation is serious and requires immediate attention. Most seizures last only a few minutes and don't require medical attention. In many cases, the person experiencing the seizure will recover on their own without any lasting effects. However, it's important to stay calm and monitor the situation closely. However, there are some situations where you should call 911 or your local emergency number immediately. These situations are critical and can escalate quickly if not addressed by medical professionals. Seizure lasts longer than 5 minutes. A seizure that continues for more than 5 minutes is known as status epilepticus and can cause significant damage to the brain. It's a medical emergency that requires prompt intervention. This could be a sign of a more serious medical condition. Repeated seizures. If someone has multiple seizures in a row without regaining consciousness, it's crucial to seek medical help. This condition can be life-threatening and needs immediate medical attention to prevent further complications. If someone has multiple seizures in a row without regaining consciousness, it's crucial to seek medical help. Difficulty breathing. If they have trouble breathing after the seizure stops, it could indicate a problem with their airway. Ensuring the person can breathe properly is vital for their recovery. If they have trouble breathing after the seizure stops, it could indicate a problem with their airway. Injury during the seizure. If they hit their head or sustained another injury, they might need medical attention. Injuries can complicate the recovery process and may require professional medical care to address. If they hit their head or sustained another injury, they might need medical attention. First-time seizure. If this is the first time they've had a seizure, it's essential to get them checked by a doctor. A first-time seizure can be a sign of an underlying health issue that needs to be diagnosed and treated. If this is the first time they've had a seizure, it's essential to get them checked by a doctor. Understanding these critical signs and knowing when to seek help can make a significant difference in the outcome of an emergency situation. Always err on the side of caution and seek medical help when in doubt. Section 6. Post-seizure care supporting recovery. After the seizure ends, the person might be confused, disoriented, or tired. It's important to stay with them until they are fully alert and aware of their surroundings. Here are some ways to help. Speak calmly and reassuringly. Let them know they are safe and that you are there to help. Help them get comfortable. Help them sit or lie down in a comfortable position. Offer water. Once they are fully alert and able to swallow, offer them a glass of water. Be patient. It might take some time for them to feel like themselves again. Avoid overwhelming them with questions. Section 7. Spreading awareness. Knowledge is power. Knowing what to do during a seizure can make a real difference. By understanding epilepsy and sharing this knowledge, we can help create a safer environment for those living with this condition. Here's how you can help. Educate yourself and others. Learn more about epilepsy and how to provide first aid. Share this information. Talk to your family, friends, and colleagues about seizures and how to respond. Be an advocate. Support organizations that raise awareness about epilepsy and fight for better treatments and support for those affected. Remember, knowledge is power. By understanding epilepsy and knowing how to respond, we can all play a part in keeping those around us safe.